I am Carrie Levy, and I work at the Rocky Mountain Regional VA in Colorado. I'm a palliative care physician and a geriatrician there. I did a geriatric fellowship in Colorado, and this was before palliative care was really an entity, and certainly before palliative care fellowships existed. And at that time, the VA was way ahead of its time and had mandated palliative care teams at all VA hospitals. So they needed someone to basically help run that program, and they said, well, you seem to like palliative care kind of things. Why don't you start that program? So what I discovered in my training was that at the VA, I had a lot of resources for older veterans. I had programs like home-based primary care and medical foster home, and I could arrange for hospice in a nursing home, and there would be no charge for the veteran in the nursing home. And a lot of resources for people that I felt were appropriate, but were really unavailable in a non-VA setting. So I really wanted to be in the VA in order to do that type of clinical care. And then when I became interested in health services research, I knew that there was this enormous amount of data available that we could use to improve programs for older adults. So the VA has a fairly unique program. Outside of the VA, it's referred to as adult foster care. In the VA, we call it medical foster home. And the foundation of it is the home-based primary care team. So VA has a very large home-based primary care team. There's actually a demonstration in Medicare right now that's modeling after the VA's program, and looks to be a very successful demonstration and will likely be taken up as a model within Medicare called Independence at Home. The home-based primary care team is an interdisciplinary team that goes to the homes of veterans who can be described as too sick to make it to clinic. Getting to clinic is too burdensome, they're too ill, it's exhausting, and it's really just hard on them. And so we end up taking the clinic to them. So there's nurse practitioners, physicians, physical therapists, recreation therapists, pharmacists. A whole interdisciplinary team wraps around that veteran and serves them at home. And it's been a very successful program within the VA. So that's the basis for the medical foster home program, but instead of being in your own home, you're in another individual's home who's foster caring for you. So just like children have foster families, this is a foster caregiver. In that program, the caregiver is providing 24/7 care in the home. They can have up to 2 additional people, so a total of 3 who they're caring for. It might be their own parent and 2 veterans. It could be 3 veterans. It can be any combination, but they can be responsible for up to 3 people in their home. So I became particularly interested in the medical foster home program as an innovation where we could allow an option for those who preferred to be at home and not in a nursing home, and wanted to be sure and study that. The safety of it, that was a big concern. You're in someone's home, it's not regulated like nursing homes. Were veterans safe? Were they well cared for? Were their outcomes good? That kind of thing. So we had a merit award to look at outcomes within the medical foster home program, and also speak to caregivers about the experience of caregiving and that type of thing. And we just had a manuscript accepted regarding the cost outcomes, and it looks to be about $100 or so a day less to be in the medical foster home per day alive compared to propensity match subjects in veterans in nursing homes. So overall, in our now 5 years or so of study, the homes tend to be very safe. The outcomes look to be good, and it appears to be a cost-effective alternative. Another example of the opportunities within the VA is the Life-Sustaining Treatment Decisions Initiative. So this was a large initiative that was disseminated throughout VA, and we had the opportunity to look at the implementation, which was done very well. It was a well-thought-out initiative, and basically on day 1 in July, when it was to go live across the country, it did. And we've been able to look at the number of life-sustaining treatment templates that have been completed for veterans and who those templates are being completed for. It appears that we are targeting the most frail, highly medically complex veterans with those templates. The idea is that for seriously ill individuals, it provides clinicians with orders for the types of treatments that people do or do not want. So that's now a nationally available template for veterans, and it's unlike anything that's been done in terms of its scope and size, and has been really exciting to see the preferences that veterans are choosing, and then also the ability to implement something on that large scale, and how quickly that can be done, and how well it can be done. A daily basis in my clinical work, I have the privilege of caring for people who are seriously ill and often within days or weeks of their final moments of life. And it is a great privilege to be a part of that important phase of life. I'm grateful for the veterans who are involved with us, and of course their families. And I'll give an example of the joy that we have in this work. People often say, how can you do this work? It sounds very sad and depressing. And here's an example of why that is not the case. We had a gentleman who was due to be married, but he was quite ill. And so on the day of his planned wedding, we actually had the wedding in the hospital. The staff, the ICU staff, the chaplains, everybody came together and made this happen. And it was a beautiful ceremony. It was a beautiful day. All of their friends and family came to the chapel in the hospital, and we were able to make that happen on their behalf. And this is just an example of veteran commitment to veterans and the type of work that VA staff just do because they care. I think it's unlike another healthcare environment that we could work in. It's just a level of dedication and commitment that is beyond, because we all have this uniting commitment to veterans, and we don't understand. If we haven't been in it, we don't understand, but we have a glimmer of what these veterans have been through, and we want to honor it as best we can. And so that's just one example of the joy that sounds a little paradoxical, but is there in providing palliative care to veterans, and the privilege of being part of that very vulnerable sometimes and an important part of a person's life.